Hi, everybody. This is Angela Marshak from TouchCare. Looks like a bunch of folks are logging in. I'm going to give everyone maybe one more minute before before we get started. So thank you, everybody, for joining the webinar. You'll all be in listen-only mode. However, please type in any questions that you have. This is being recorded, and we're happy to send it out after the webinar. On the line today, we have the following guests. First, my name is Angela Marshak, and I'm the Vice President of Sales at TouchCare. We also have our CEO from TouchCare, Rob Lehane, and Mike McCormick, the President of GIS Benefits. What we'd like to cover today is Mike will introduce you all to those of you that don't know GIS, give an overview of who they are and how they're impacting the benefits space. We'll then move on to Rob Lehane, where he'll go over who TouchCare is and why we were even started. And then I'll finish off with some cost containment and stress reduction strategies for both employers and brokers or members as well. And then we'll end it with a Q&A. So with that, Mike, if you'd like to kick it off.
Yes, happy to do so. Thanks, Angela, and good morning, everybody. As Angela just referenced, my name is Mike McCormick, and I have overall responsibilities for our GIS benefits business in the Northeast. I'm going to spend just a few minutes sharing a quick peek into our firm, GIS Benefits, some of you may or may not be familiar with, and specifically get into how we deliver and service to our brokers and customers across the markets. As I'm sure everybody would agree, the benefits landscape is changing daily. If we look back over the course of recent time, be that years or decades, I think on the economic, legislative, and technological front, I think it's forced us all to think a little bit differently, creatively, around more efficient and effective ways to manage the benefits we not only extend, but as importantly, the process by which they're delivered to both employees and to employers, HR professionals, with an eye on increasing value and minimizing stress. But at the same time, I think we'd all acknowledge that when it comes to efficiency, much is lost in the paper. So if we look at the next illustration here, we've seen a pretty significant shift to going paperless. Next slide. So much so that if you look back just a few short years ago, based on a survey that was run by the Small Business Administration, the estimate was that only 2% of the nation's 6 million small businesses between 50 and 500 employees were operating their benefits online. And while things have changed to the positive, improved over the last few years here, nonetheless, what I think you see is a pretty substantial opportunity that lies ahead. Call it a tsunami or a blue ocean in this world of benefits. And that's a big part of who we are at GIS and the value prop that we deliver. If you just take a quick look at our footprint, next slide, we play in a bit of a unique economic model. We'll get into that. I'll get into that in just a moment. But specifically in the context of HR tax and communications, we aim to deliver a comprehensive set of solutions designed to streamline enrollment and then admin. Today we cover off on a national footprint across 25 markets, serving almost 6,000 employer groups and a lot of ancillary premium under management. But our mission remains the same as it was when we originated years back, 15 years plus, with an eye on figuring out how to deliver Fortune 500 benefits to the middle market. Think about that for just a second. Fortune 500 benefits to 50 life groups. Why is it that small and mid-tiered customers shouldn't get what the big guys get? Be that in the context of the employee's experience as a consumer, with access to decision support so that they can make informed benefit choices, to the tools that are distilled to HR professionals, making their lives not only more efficient but a little bit easier. Ultimately, with an eye on the benefit options that are extended, with an eye to help employers attract and retain quality talent, and deliver those benefits in a personalized way. And that's why we're so excited about the partnership that we have with TouchCare as a recent addition to our portfolio companies. So if you just for a second stop and think about who we are as a team, next slide, and why we've been growing, it's really pretty simple. It's us listening to the markets and responding to what they're demanding. And we have kind of positioned ourselves, if you will, as an extension of the collective teams for technology, enrollment, admin services, and marketing. We bring a full array of technology options, which is illustrated here on the next slide. Very much designed to provide a cross-section of SaaS solutions. Next slide, Angela. From the simple shift to paperless in standing up Benefits Express and Benefits Connect, all the way through a full suite of integrated online options and Ben admin solutions. Alongside that, we are able to deliver a turnkey suite of enrollment options. So not only being able to stand up the Ben admin, but deliver that personalized employee experience online, on site, and via our benefit center, which we have showcased here on the next slide. This headline allows us to deliver a fully integrated Ben admin experience alongside a turnkey benefit center to help facilitate employee onboarding, education, and benefits enrollment. And since we operate as a TPA and a GA, we're able to deliver on key functions that the market is expecting. Everything from things like EDI to combined billing, all the way through leveraging the significant volume that we're driving to share in the purchasing power of the relationships that we have with many carriers on the ancillary front, not the least of which is TouchCare. So the bottom line is this. We work and have been working really hard to bring the best possible experience to employees when it comes to enrolling, and to employers when it comes to administering. And that's why we see our partnership with TouchCare to be so compelling, because they are clearly immersed in ensuring that members have the optimal experience when it comes to using their benefits. And so with that, I'm going to turn it over to TouchCare CEO Rob Lehane to get us started.
Sure, thanks, Mike. And obviously, we're very excited about the partnership as well. So getting in real quick to an overview of TouchCare before I kick it back over to Angela to get more in depth. So TouchCare, as a company, we actually got our start as a project really within a large employer, a large public company, who was looking for a service to give their members a better experience. And what came out of it was really, hey, healthcare is confusing, which is a topic that I'm sure is close to everybody's heart and mind on this call right now. Healthcare is confusing and it's expensive. And my employees or my consumers' behavior is actually contributing to some of the cost of our overall costs as a business that's offering health insurance to our employees. So we designed a white glove concierge program initially with this one large employer, with the goal in mind of helping folks shop for services in the healthcare system. And our goal was initially to create better consumers out of plan members with a lean towards how we can help reduce unnecessary costs that are contributing to the overall cost of the healthcare plan. From there, really the company evolved, and this was in 2014, the company evolved into what it is today, which is still a white glove healthcare concierge service, also a technology company in the sense that we do build apps and portals for folks to be able to act like better consumers with regards to navigating the healthcare system. But at the end of the day, our goal is to provide a high-end white glove service to employees of employers, specifically in the mid-market, which is one of the reasons why we're so excited about the partnership with GIS. So really employers in that 50 to 500 space is kind of the sweet spot, or 55,000 spaces, the sweet spot that we work in, and I'll kind of get into some of the reasons behind that. But if you take a step back and think about the dynamic in healthcare over the last 20 years, you sort of had, and this is no secret to anybody on the line, had this drastic increase in cost that has resulted in a shift of cost burden moving on to consumers. And so when I got my start in this industry in 2006, the average deductible was about $300 for an individual enrolled in a healthcare plan through their employer. Today, that deductible is about $1,900. So then if you take all of the other factors that have sort of go into the dynamics of what is our healthcare system, it's very confusing, it's very expensive, it's lacking in transparency, and now employers have started to shift some of the cost burden onto employees just to be able to continue offering health insurance to their employees. You've got a situation where it now really matters to me as a member where I get my care. And then that last dynamic is the fact that 96% of Americans can't accurately define the four key most important terms associated with the health insurance plan: coinsurance, copay, deductible, and max out of pocket. So then you end up with folks delaying care, folks confused on where to get care, and just generally unable to effectively navigate the healthcare system and potentially overpaying for services. So TouchCare, as I mentioned, has designed a service that is intended to be very much a white glove hand-holding experience to help folks navigate all of the confusion within the healthcare system. So that can be anything from starting with open enrollment and questions around plan designs and selections, all the way through complex billing scenarios or procedure planning. And I always tell folks when they ask me, what's your target demographic or your target employer? And I say, look, any employer who is struggling with the increase in cost of their health insurance plan and who has employees who are confused in navigating the healthcare system. And so what that ends up with, of course, is really every employer. So we work with employers from, venture-backed startups all the way to sort of your tried and true family businesses that have been around for over a couple hundred years, really. And so, at the end of the day, our goal is to put the member back at the center of attention of the healthcare system by helping them navigate both their insurance and the healthcare system itself more effectively. And so what are our primary business objectives? Number one, first and foremost, happier employees. We want to give employees and their family members a better experience with navigating healthcare through the entire life cycle of their dealings with the healthcare system. And then number two is really cost savings and making sure people get the most bang out of their healthcare buck. So back to that initial dynamic of, we have a $300 deductible 15 years ago, and now it's an average of $1,900. It really matters where you get care, right? Because the cost of an MRI is an easy example. Could be $400 in an imaging center or $4,000 at the hospital right across the street. And so number one, first and foremost, give employees a better experience with something that is causing them a lot of stress and costing them a lot of money. And then number two, make sure that we can help them find the highest quality, lowest cost care. With that, I'll kick it over to Angela to take us through the rest.
Thank you, Rob, and thanks, Mike. That was great. So at TouchCare, what we've strived to do is really disrupt the advocacy space and find a way that we can truly partner with brokers to make sure that we are giving their clients and members the best experience when it relates to the benefit package. And the first way that we thought we could do it was by giving each client their own dedicated team of personal healthcare assistants, or pods as we call it. And the goal of this is to really scale the team based on the client size. So generally you'll have anywhere between 3 and 6 dedicated health assistants. There'll be billing experts, folks that are licensed in life and health. That way they can speak intelligently about benefits. And what we call is our care navigators, where their whole job is to find the highest quality, lowest costing providers. Because if we've seen, what we've already seen is that there is no transparency in the space. People are confused and they need us to really hold their hands and help them make these educated decisions. At TouchCare, we believe that there's a time and place for human versus technology, so we have all of it. Our humans are located in New Jersey. They're available from 8 a.m. to 9 p.m. Eastern Time, Monday through Friday, and we have no wait times when the member reaches out. So the member will be put on a 40-second hold to see if the health assistants are available to answer the line. If they're not, they're put into voicemail where a health assistant is getting back to them in under an hour. Responsiveness is extremely important to us at TouchCare. We know that, folks, if you don't mind muting the line. Thank you. So we know that healthcare is personal. People want to reach a human to have a conversation. And knowing that this human actually has their best interest in mind, we found to be very impactful. However, we do realize that people always don't want to speak to somebody. Technology is also very important. So we are also a technology company. We have a really robust mobile app, web portal, and email. So what you'd be able to do is the member could reach out via any one of the technologies. They get an automated message letting them know that we've received the ticket and we're getting back to them in under an hour. In the technology, we also house all the plan designs. So it's important to note that not only are we helping members with medical, which tends to be one of the most problematic benefits, but we want to take a holistic approach to how we work with them. So we're also covering every single line of coverage. We want to be a single source solution that members can come to for all benefit related questions, concerns, navigation, and so on. And that's where we see a nice synergy as well with working with GIS, and why we've created this partnership is that you have front-end support, right, all year round. You have technology to support you. It becomes a really nice synergistic relationship for our brokers and clients and members alike. So on the slide here, you're going to see that we have a ton of different services we offer. You know, if it was up to me, I could keep you on the phone all day. I'm so passionate about what we do and how we really impact our members' lives on a daily basis. But I'll hit on a few of the key areas in a moment. But before I go there, there are two numbers that really make an impact on the left side. First and foremost, our members love the team. We have a 98% member satisfaction. They realize that our team is kind and compassionate, resourceful, reassuring. They truly have their best interests in mind. And when members write testimonials, they're always talking about our team on a first name basis because they start to build that really personal relationship with them. The other key that for folks that know about advocacy in the space, right, we call it a concierge. It's just a fancy way of saying advocacy, and it's because we do take it to the next level. As much as we are a white glove service, we are also a marketing company. And what I mean by that is we are not a PDF at open enrollment that's given to members and then they forget that we exist all year. We have very creative and strategic ways that we're continuously engaging with members all year round. So I'll talk about that more towards the end of the presentation. But the number I want to stick in your mind is the fact that we aim and we almost always achieve a minimum of 20% engagement in just the first year. That means that 20% of the population will be reaching out to TouchCare with a need during the course of the first year. It's not counted as downloading an app. This is folks really reaching out for our team to help them, which will in turn create that better consumer and help lower our members' costs. So let's jump into it. These are the four key areas that we find our brokers and our clients love the most with our services and how we're really setting ourselves apart. The first is we want to support open enrollment. We realize it's the most stressful time of year for brokers, clients, employees, and it's the most confusing for our members. So in conjunction with GIS, it's great because they offer the open enrollment support, right? We have it here as well. So as a combination between the two organizations, we're really able to come up with the best open enrollment strategy that works for your client. So it's not duplicative, right? We figure out which one works the best and put that in place. What we do is, with our support, we are offering it on a voluntary basis where we need to go live when open enrollment starts. That's a key. So we're not going live on the effective date. It's actually when open enrollment starts. That way our team is available for 30-minute telephonic consultations to help the member and their family make an educated decision on the benefit package created. We know that folks tend to lose focus during open enrollment meetings. We know that I know there's a lot of brokers on the line today, and it's super frustrating because then they're just calling you or they're calling your client after. We want to alleviate all of this and take it off your plate and allow the members to come to us where the licensed representative on their team can really hold their hand, answer all the questions, and help them make an educated decision. I do want to clarify, we are not an enrollment firm. So we end that call with written confirmation of what was discussed, and the member is going to go and enroll in whatever technology you have them using, whether through GIS, maybe it's still paper-driven, but we're just here to help them make educated decisions on the entire benefit package. This is also important to note for growing organizations. You might have a lot of new hires coming on. This product is available all year where you just put a note, at the end of the new hire kit that any questions on the benefit package, reach out to TouchCare. They're here to assist. Care navigation is very important, right? It's kind of scary. We almost have to retrain people to stop thinking that their doctor knows best. Yes, of course, they know best on how to diagnose them and treat them. But what they don't know is which imaging facility is the most cost-effective or where to get the care that's needed at the highest quality lowest costing. That's where we come in. We want to make sure that we truly are on our members' side to find them the most cost-effective prescription drugs, imaging, providers, surgeons, facilities, anesthesiologists, right? Because there's so much that goes into healthcare and the system, and most people have no idea the costs associated. So what we do is we produce reports to our members where we can actually show them physician ratings, the procedure price, and how it varies with similar rated providers, that the carrier has different discounted rates. Most people just are in the mindset that, oh, if I'm going in network, well, then the price is just going to be the same. Nope, right? The carriers have different discounted rates with each provider. And then what does their out-of-pocket exposure look like? We collect a lot of information. We have a multi-step process that works extremely well on how we gather this information, because what we realize is that there is no one tool or magic bullet that works to get this information over to our members. Our team is very thorough. They make sure they take all the steps needed to find the best providers out there for our members. We'll also take it a step further and send this to them and let them know that we can help schedule the appointment, transfer any records, and help move any pre-authorizations along so they can get the health care that's needed. Billing review and negotiation is by far our most common case. It's scary that 75% of hospital bills are not correct and over 50% of provider bills. It becomes our team's job to make sure that we are fighting on our members' behalf. First off, we ask the member to take a picture of the bill or send it to us somehow so we can make sure it's coded correctly. If it's not, then we are working with providers, the carriers, the collection agencies, any of the parties that are involved to make sure that we are taking it off the member's plate, alleviating that stress for them, making sure that they're not dealing with this and that we're getting it corrected. A lot of times when we have conversations with our brokers, we hear that they do this vast majority of the time. And, no broker got into the business for having to deal with billing, review and negotiations, right? So we have many different ways that we can partner to alleviate this stress from our brokers as well and allow them to still look like the superstar to their clients, where we're essentially working completely behind the scenes and helping you with all of this. Our billing experts have over 30 plus years of experience in the space. We have master coders on the team. So these are not people that are brand new that are doing this. These are folks that really know how to navigate the system and make sure that we are working on behalf of our members. Last but not least is our RX care. And this is a pharmacy drug consultation. So what this is we promote to our members that if you're taking any sort of prescription drug or maintenance medication, whether it's a one-time expensive fill or maintenance, come to us. Let us do all the research to make sure that you are getting the most cost-effective drug. So we have licenses. We have a license with a PBM called RX Valet, where 40% of the time we are actually able to find our members less expensive options. If so, the benefit there is not only for the member because they're saving money, but it's outside the medical plan. So if you have a level funded or self-insured employer, well, now we're taking this expensive drug off of your plan as well, because the member is able to pay for it with their money account or a credit card. So this solution's worked really well. If we can't, find it through RX Valet, well, then we just look and see which pharmacy in the area is more cost effective, or is there a 90-day supply, a 6-month mail order? right? What are ways that we can make it more convenient for our members? So those are our services at a high level. As I said, I can go through much more, but hopefully we'll all have conversations after this. Just to kind of tie it together, when you think of TouchCare, think of us as the hub or the traffic cop and the member's personal healthcare assistance, right? So we're going to fully understand the entire benefit package that our brokers have created for their clients. But then we take it one step further and understand, is there a telemedicine plan in place, an EAP, second opinion, wellness? We want to understand the whole package that's been created. That way, when a member comes to us, we can make sure that not only are we getting more engagement for our services, but we're also helping members with these other great options that have been provided to them that they tend to forget exist. So as an example, oftentimes members will come to us and say, hey, I can't get my kid into the pediatrician, either they're booked or it's after hours. Can you find me an in-network urgent care or ER? We pull up the file and we actually see that there's a telemedicine plan that's in place. Keep in mind that we deal with all carriers, all providers, all different vendors. We are agnostic. So we're, as long as that information is provided to us, we can direct that member to who the telemedicine carrier is, how it works, and if there's a copay or fee associated with using the service. Same exact with the EAP programs and such. So how do we save, right? There's so many different ways that we could save for our members. The key that I do want to stress is that our main goal at TouchCare is to create a better member experience with using their benefit package and navigating the healthcare system. That's number one, right? Cost savings, sure. We all want to be able to show an ROI to our clients, and we're able to do that. I just always like to point out that, when we talk to our clients and our brokers, I think most of us agree that the member experience is so important and top of mind for most of our clients that this is all just bonus, right, from here. So when we think about our larger, self-insured employers, there's 5 key areas that we'll actually report on. We create a quarterly business review for any clients over 500 lives that will dive into these areas based on the cases that have come to TouchCare. So cost comparisons, those reports that I showed you, how are we directing the care to the highest quality, lowest costing provider? We'll calculate all of those cases. Directing care in network, how many times do people go out of network because they just don't ask the right questions? So we're extremely proactive. We're making sure that they're coming to us first and we're keeping them in network. Proactive health management is actually a big one. A lot of the campaigns and the marketing that we do year round is about creating awareness, how to be a healthier individual, how to use your benefits more effectively. So a lot of the campaigns are around having your physical, creating a relationship with a primary care physician, getting that mental or behavioral health care that you need, but maybe you've been so afraid to ask for help with. We'll take all that information as well and come up with a dollar amount. Bill review and negotiation, as you can imagine, is a big one. We're finding a ton of errors. We're making sure that we are correcting them for our clients. And then the last piece of it is a soft cost, but it's important to note that every time a member submits a case, we'll ask them, how many labor hours did we save you? On average, we're saving them about 3.5 labor hours, which equates to about $215 per interaction. So we take all of that, we make it into about a 12 to 15 page report, depending on how much data we have. The case reasons is a part of this report as well. And we'll ask, our brokers and our clients to sit down on a quarterly basis to discuss this. Now, for clients under 500 lives, which a lot of, our average client is under 500 lives at this time, we produce a report that's semi-annual. It's 3 pages. It goes over our speed to answer, our speed to resolve a case, which is between 12 to 48 hours, depending on the case. And then what type of cases have come in, how have the members reached out? Is it via phone, technology? Is, multiple folks in different locations reaching out? Important to note, we are completely HIPAA compliant. So we are never going to be giving member-specific information out. It's just across the entire population. So how do we engage, right? That's the key to this is in order for us to reduce stress, to help our brokers, to create a better consumer of healthcare, members have to know that we exist. And what I'll tell you is we do anything and everything. We try really hard to think of creative ways to capture our members' attention so that they are using us all year round. So we have an engagement calendar for our entire book of business. And this is an example of what we did in Q2 this year. April was Stress Awareness Month, May was Dental and Vision, and June was Refresher Benefits Knowledge, right? We know the vast majority of people, I think it's 80% of them, renew on 1/1. So we're 6 months in. Reach out to TouchCare, schedule a 15-minute benefit refresher for us to go over your whole benefit package or any healthcare needs that you have this coming year. So every month we have a different theme. It's not about TouchCare, right? Or it's not about GIS or any of our partners. It's truly about our members, but we're tying in different topics that we know resonate with almost the entire population. And what we do is we have a subject matter expert come onto a webinar. So in April, as an example, we had a mental health professional to talk about healthy ways to alleviate stress, right? They're 20 minutes, they're held multiple times a day, and at the very end, it's a quick 30 seconds on who TouchCare is and how we can help them. And then we tie a contest to every monthly theme. Most of the time, it's either a subscription to some sort of magazine or it's a gift card where Warby Parker in May was huge. We had a ton of cases come in, tons of questions because as we all know, people like to win things. So those are just, 2 creative ways that we communicate. Building a relationship with HR is extremely important, as well as our brokers. So understanding how our clients communicate with their employees all builds into this. And for our larger employers, we can actually create custom engagement strategies. So with 2 more minutes to go, because we want to try to keep this to 45 minutes since we know it is a crazy time of year, I want to touch on 3 premium services that TouchCare has rolled out this year. So everything that we discussed is part of TouchCare's traditional model. And what we have now are 3 buy-up services because we've realized from all the cases that come in, members need additional layers of support that can help lower their costs and can be outside the medical plan to lower our employers' costs. So when we're thinking of, value-added services, TouchCare, GIS, it goes without saying that we are, but these are now additional programs that TouchCare has created strategic partnerships with, just like GIS, to work behind the scenes to make the member experience seamless. So our MD Opinions is the first one. This is a robust second opinion program where it is world-renowned subject matter experts and doctors from around the country that are the best at what they do. So members come to us, let's use cancer as an example. It's our largest ticket item. And they have $0 copay to use the service. It's telephonic or virtual. TouchCare gets all the information and makes sure that we are finding them the appropriate clinician to speak with. They can have unlimited consultations with these individuals, and it's outside the plan. So a lot of people are familiar with Grand Rounds or Best Doctors. They're pretty pricey. We are able to offer this service at a very reasonable cost that's added on to the TouchCare package, and we do all the work behind the scenes and, of course, a consolidated bill. The next is our virtual ER. This is a robust telemedicine program. So it can treat the same things that a traditional telemedicine program can. However, it goes above and beyond your typical, sore throat, strep throat, ear infection. Because this is a network of ER doctors, they can treat and triage 98% of the cases that come over the phone or video chat. So when we think about, again, hey, how are we able to start lowering costs? We know that our employees are overutilizing the urgent care, they're overutilizing the ER. A service like the virtual ER can come in. It's a $0 copay for the member, and unlimited utilization, again, right? So we want them to use it a lot, and it's outside the medical plan. So now the employer is getting rid of a lot of those urgent care and ER claims that are coming in, and they have a network of ER doctors at their fingertips that are getting back to the member in under 7 minutes. Last but not least, we have, as of November 1st, this is our newest add-on service, and this is Mind Care. This is giving members the ability to speak to licensed clinicians for mental and behavioral health. This by far is the most that we at TouchCare struggle with, because there's a ton of folks out there that need to get mental or behavioral health help immediately, and there is not a lot of in-network providers taking new patients, period. Most of them are out of network, still have long wait times to get a member in, so we needed to solve for this problem quickly. Same like our other products, the member would come to TouchCare, we find out who they need to see, and in 24 hours, we are getting them an appointment to have a video or telephonic consultation with a licensed clinician. This, again, is unlimited utilization for our members. It is outside the medical plan, but with this one, there is 2 different copay or session fees that you would be offering your employer, either a $50 session fee or a $75 fee. And this is either the member can just continuously have telephonic consultations with this licensed clinician because they really like them, or we can be working behind the scenes to find them that person that they're going to build a relationship with in network. I'm happy to talk offline on all of these services in more detail. I know it's just very high level, but I wanted to give an overview. And just to end it off with getting started with TouchCare and GIS is really simple. We do all the work, right, with you and the broker behind the scenes. Our clients generally have minimal exposure to implementing a case with us, which is really nice. So we're happy to talk about how to implement. We know that this is, it's go time for the vast majority of us. When implementing TouchCare, we need a minimum of 2 weeks lead time. So we still have plenty of time for these one-one opportunities. I have 11, 15 cases still coming across my desk as we speak. I thank you, and on behalf of all of us, we really appreciate your time today and want to open it up for any questions that you all might have. So I have a question here actually that's already come in, and it's on reference-based pricing. Yes, reference-based pricing has been a hot topic for us over the past few months. I see that this is the way that healthcare is moving, and the answer is absolutely. TouchCare, when you think about how TouchCare could fit into RBP, we are sitting in the member experience. So many times we've had brokers reach out to us because they put in reference-based pricing and the members just don't get it. There's 3 different people to reach out to, whether it's a TPA, whether it's a repricer. They don't know who to go to for what. They don't really know how it actually works. Because if we go back to our earlier slides, people are just confused with healthcare altogether. So TouchCare comes in as that traffic cop. We are the main point of contact for the members to reach out to. And then we are working behind the scenes with all the other vendors and carriers involved to make sure that that member and that employer has the best experience with using that entire benefit package. So I would love to have one-off conversations about how we work. We always have to have a conversation with who the TPA is and who else is involved to make sure that they are okay with having TouchCare as the main point of contact as well. I think we have over 15 clients currently with RBP, and each one of them has been a different type of experience. So we know how to handle it. We become the main point of contact and we keep it seamless to the member. Great question. The next question coming in is, do you have a brief video we can use with clients? I do. We have a video of our mobile app. However, I would love to offer up our team here at GIS as well as TouchCare to be your subject matter experts. We believe in true partnership with our brokers, and we want to make sure that we're able to, give you enough information to be dangerous, so that way you can introduce who we are. So we'll give you marketing material, videos, quick blurbs. But then when you have a client that wants more details, bring us in. We're happy to go over who we are and what we do, whether it's through a web meeting or an in-person meeting, because we do cover the entire country. Next question that's coming in is, what separates TouchCare services from our competition? I would say the 2 key pieces of this are by far the fact that we're a true partner, that we are giving dedicated teams of health assistants to each client. So the members are not going into a call center. They're building relationships with individuals that they know care and have their interest in hand. And we're also partnering with our brokers and our clients to make sure that they're having the best experience with us. And then I'd say the second to that is that we are a service that people know and use. Typical advocacy teeters at 2 to 3% engagement. We are over 20% in just the first year and goes up from there. I had someone raise their hand, and I apologize because I don't know how to unclick you. Bear with me, I'll try to get back to that. We have some other questions coming in here. Not sure how the partnership with GIS fits in with TouchCare. Hey, Mike, are you on the line that you want to talk to that one, or you want me to talk?
I am on the line. Can you hear me?
I can.
Okay, terrific. I'm happy to. So GIS.
Hey, Mike, I think we might have lost you. Can you hear us? Hey, Mike, can you hear us? Can everyone hear me? Hey, guys, I think we just lost Mike. I apologize. but I will. Mike, are you back? Nope. Okay. So I will answer on behalf of Mike because I think he's driving, so we lost him. So the way that GIS fits in with TouchCare is twofold. We're all partnering with brokers. Our goal is to go out and make sure that we are finding the best solutions and services out there for our clients. And GIS has a whole entire platform, right? You saw the technology platforms they have, where TouchCare is actually on there for any benefit-related questions, concerns, and help. So think of us literally as a button that's on there. GIS sends us all of the plan designs, all the enrollments. So GIS is taking a ton of the workload off of our brokers when we implement cases together as well. Rob, did you want to add anything else to that you think I missed on the GIS partnership? All right, I think we're having some sort of audio problems and I can't hear anyone else on there. We have other questions coming in. Is there a fee for GIS? Oh, are you there?
Yeah, I'm here. This is Rob. I was answering your question and it just said unmuted, so I think you might have unmuted me. But anyways, to answer the question, you know, at Mike's outset with the GIS mission to be able to provide Fortune 500 benefits down to the mid market, I think aligns very nicely with our own goal. You know, when we started the company, as I mentioned, we were working with initially and targeting very large self-insured employers only as a way to help them sort of control costs in their healthcare plan. And really what we realized is the mid-market, small to mid-market really lacks great options for what TouchCare does. So we actually pivoted our focus to focus primarily on the small to mid-market as well. You know, sort of agnostic as it relates to plan structure, whether that be, or funding structure, whether that be fully insured, level funded, self-funded, reference-based pricing, as Angela mentioned. We want to deliver better experience and better service to that small to mid-market customer as well. So we fit nicely with the GIS mission and it fits, you know, nicely in with ours.
Thanks, Rob. I have a couple more questions that came in. Where are you with Spanish speaking? We do have bilingual on the TouchCare side. So during the implementation process, it's important for us to know that we have Spanish speaking individuals, and we'll make sure that we put a health assistant on that team that is bilingual. Another question on how long does it take for a member to receive a cost comparison report once it's requested? So there's two parts to that question. Most of the time, members are reaching out to us at TouchCare to find a specialist where they have some time. So 12 to 24 hours for a traditional cost comparison report, unless it's a unicorn, where people are looking for something extremely specific, maybe a mental health professional that's female, that's had, 25 plus experiences, 25 plus years of experience with certain credentials and in a very remote part of the country. That could take us longer. We let the member know. However, if it's an emergency, member went to a doctor, just found out that they need an MRI of their brain ASAP. The team puts that at top priority and they will turn it around very quickly for the member. They just want to make sure that they're still finding that highest quality, lowest costing. But now that comes to top of the list and we can get that over in just a few hours. We'll ask often if there's a self-serve option But what we've found, especially with our competition, is that most of our competition that has it, they're losing business because the tools are just not accurate. The carriers don't provide real-time information, the providers don't, and the advocacy solution gets blamed for any error there. So we have our process down that's really good, and it's still very fast turnaround time. Is there a fee for GIS partnership? Is the next question that's out there. I don't know if we have Mike back on the line, or if Rob, you want to talk about that?
Sure. I'm not sure if Mike's back or not. No, there's no additional fee for the GIS partnership. In fact, we can be brought in with the GIS team, obviously, as a partner to their TPA services. We're included in the bundled bill from the TPA, so administratively it makes it very simple, as Ange mentioned, for GIS clients as well.
Thanks, Rob. Let's see here. Is there telephonic assistance work at TouchCare? Or, how does the telephonic assistance work? So the telephonic assistance is the dedicated team of health assistants. So that's where the member can reach out, a 40-second wait time, and we prompt them to leave a voicemail if the team is all busy, and we're getting back to the member in under an hour. I'm just looking to see if I've hit all the questions here. If we structure a plan designed to steer members towards lower cost, higher value outlets for imaging labs, etc., can you support it? Absolutely. We have brokers get very creative with the types of programs that they're putting in place for their clients. And this is why we think it's so important to have a strategic partnership and a close partnership with our brokers, because we want to understand, what have you created, right? What does that network look like? A lot of times they're called these green zone providers, and we will make sure that we take that information, we give that to the dedicated team of health assistants and train them appropriately on what that looks like. When you think of TouchCare, we are not a box. We really create our solutions hand in hand, right, with GIS to make that makes the most sense for what that broker is trying to achieve and what that client is trying to achieve. So I can tell you that our relationships with our brokers and our clients are all different from one another, and it's all the same goal, which is to give a better member experience and help lower costs. With that, I think we've answered all the questions. We really appreciate everyone's time today. So many of you stayed on the line longer than we had hoped. So sorry for going over, but these were some great questions. We will follow up with you and hope to schedule time to speak with each of you individually for both our services, and hope to partner. Thanks again, everybody. Have a wonderful day, and look forward to speaking.